Good morning to everyone that is joining us via Zoom or live on Facebook. As a reminder, we are recording the video. We will be releasing it out on Facebook later today for those that were not able to join us this morning. So it's December 10th. We're almost through the year, but welcome to our York County Community Sector Briefing. And I would like to kick us off by introducing Laura McDougall, our Executive Director with Four Corners Health Department. Laura, you're up.
Thanks, Lisa. Good to see everyone this morning.
Can't hear you.
Oh.
Still
Not hearing me yet? You can hear me. Okay, good. Thank you.
Hold on. There you go.
Can you hear me now?
Yeah.
All right.
My issue, not yours.
Okay. Good. Well, you never know. It's okay. Good. We got that ironed out. So thank you, everybody, for participating today. It was good to get up this morning and know that I was going to be able to come to this briefing and give better news than I have in the past. We definitely have been seeing some improvement in the case numbers, and figuring everything yesterday and announcing all the cases that we'd had up through yesterday. Being able to announce that we only had 71 new cases in the past 2 days was wonderful, because we have just regularly been over 100. We have been seeing that things are tapering down a little bit. They're trending down a little bit in terms of case numbers. In the last 14 days, we've had 562 new cases. But in the last 7 days, it was just 262. Back at the peak of what we were looking at towards the mid to end of November, we were getting used to seeing in 1 week, in 7 days, having 400 cases. So, this is a definite improvement. It still is, I want to caution everybody that we still have a lot of road to travel to get those counts down, but it's just it's almost like we can take a bit of a breath again here, and just seeing that things are trending down, and it's just a sight for sore eyes. So thank you, everyone, for all your efforts, and it is definitely good to see those numbers decreasing. One of the things that has happened in the last, or it actually happened yesterday, is we were sent a spreadsheet that updated us on all the deaths and all the death certificates that have happened. And as has happened to us locally, the state has also been very kind of tied up trying to just get through this peak. We have been everyone got behind reporting on the deaths. So I'm going to be issuing a press release later today, and probably tonight, about the just going through some of the deaths we suspected were COVID, but now it is confirmed on the death certificates that they were COVID, and it's about 12 people. So just know that these have been deaths that have happened over the past probably 4 weeks that just never were the accounting for has not caught up to the deaths. So they were spaced out. They weren't just on one day or anything, but we will be releasing that. 2 of those deaths will be from York County. But we'll make sure that comes out in a press release tonight. Then I think the other things I wanted to talk about, we are going to be recalculating our risk dial here today. And I'm hopeful with some of the trending downwards on these counts that's going to be reflected in the risk dial. Our risk dial is really kind of based on rolling 3-week averages. Things have been trending in a little bit better direction. So hoping that, we can see some improvement in our risk dial as well. I want to talk a little bit about the new directed health measures that came out. There has been a change from the CDC recommendation on how quarantine and isolation has been recommended. So, we had spent our whole first, every week that we've been doing this, we've been talking about you can't test out of quarantine. Well, the CDC has changed that now. And it is possible to, on day 5 or later of your quarantine, if you have no symptoms, go get a test and be able to get out of quarantine after day 7. So that would be on day 8 after day 7. So with that, though, comes a lot of logistical issues for us as a district and a county. And so I believe hopefully our healthcare can talk about what kind of testing options are available here. And so if people do want to try to get a test, if they have been in quarantine, to try to come back to work or whatever, or to school faster, that they can do that. So I'll let Jim, hopefully will be able to talk about that. And the other thing is if you don't test and you still have no symptoms, you can get out on day 11. So you are in quarantine for 10 days following your exposure, and then you can get out on day 11 instead of 14. We still recommend, though, that you are very careful, though, those following days up to day 14, and wear your mask very faithfully, and watch for symptoms, because it doesn't change the fact that there still are people who get sick within those 14 days, but you want to really be watching for that. But there are some other options now if you're in quarantine, to come back to work and things. So that's been a big change in our directed health measures. And just if you have questions, of course, you can always call Four Corners as well. I think I also wanted to mention vaccine. And I know this has been a hot topic. We have been working on, as a group of healthcare providers and those first tier vaccination providers for the COVID vaccine, on how this is going to roll out. And we are, of course, preparing for it. We know that some of the frontline healthcare workers are going to be the first ones to get it. We probably will not see vaccine, though, next week. We are probably going to see it, we're hoping, around Christmas-ish week. So we're hoping to see it sometime that week of Christmas to come into our district. Now, of course, this is all conjecture at this point. There's a lot of things that have to fall into place to be able to do that, but there is a plan. And we've been working closely with York General and Henderson Healthcare and the different, of course, with all of the medical providers around. So knowing that those healthcare workers will be the first ones, and how that's going to roll out. So just stay tuned. We'll have more on that as we get a little bit closer and we know that vaccine's been approved and things. So with that, Tom, do you have anything you want to add with PPE or maybe my Tom?
Hold on. No, sorry. I didn't get it off. Working on risk dial stuff at the same time here. As far as PPE, we're still holding steady. I know there's a couple of things we're starting to run into shortages. The state, however, has assured me that those are coming, but I'm just kind of sitting back waiting to see what's going to happen with that. So in that sense, we still need to be vigilant with our PPE and make sure we are reducing and reusing wherever we can, changing clinical practices to make that PPE last longer, and stuff like that. And I would echo also what Laura had said. Even I was on a call about vaccinations last night, and I think you're spot on there. I don't think we're going to necessarily see anything here in the Four Corners area until that week of Christmas. But hey, information changes hourly, so we'll see what happens.
All right. So thanks everybody. And again, we're very encouraged just seeing some of those numbers trending downwards on our case counts. And that of course later becomes reflected in our hospitalizations and in deaths. So we are very grateful for all the work everyone's doing. And I am available for questions if anybody has any. Thanks.
Thank you very much, Laura. We really appreciate the team at Four Corners. You guys are doing a good job. And with that, we'll move on to the medical sector. Jim, are you available at this time?
Yes, I am. Good morning to everybody. I'll shake up the order of what I was going to talk about a little bit, just to echo what Laura's saying about some positive things that we're seeing. And really just to probably talk a little bit about where the hospitalization numbers are. We just have the DHHS website front page, and it as of this morning, which have been reflective of through last night, the hospitalizations are down to 781. That's a high number still. That echoes what Laura says, even though it's good news, it's a high number still. But back on November 20th, I believe, the height that we had for hospitalization statewide was 987. So we're down from 987 down to 781. Nice drop on that end. And so that really relieves in our hospital settings here in our district that there's more availability likely on a daily basis in the health systems in Bryan and St. E's and Grand Island and so forth. And so that gives us more options if we need to transfer patients out that are COVID patients, for instance. So that's a piece of good news to see. Let's certainly hope that trend continues, because on that same website, it shows a red line right at 1,000. It looks to be, if hospitalizations rise up to that, look for another set of directed health measures from the governor, which curtail even further our ability to do elective surgery like that, as well as probably other restrictions throughout our communities. So so far so good. We're in that window of getting closer to a month after Thanksgiving, believe it or not. We'll be coming up in well, I guess it's not quite that. I'm stretching that a little bit. But anyways, past that 14-day period of Thanksgiving we're getting on. So every day that goes past that period continues to be a little bit better news on maybe an uptick in cases following a holiday. So keep our fingers crossed on that, certainly. So as far as our testing activities that we're doing, we're continuing to remain busy, and this is where I'll interject what Laura said on our testing capabilities that we have. But just over last Friday, Saturday, Sunday, Monday, and Tuesday alone, we performed 100 tests in our drive-through testing. And now that drive-through testing takes a doctor's order. So that's one. So that's when you're gonna need to show some symptoms to get that kind of testing. And so that's one option, certainly, because we have the Wednesday Test Nebraska, and those are the options that we really have at this point throughout our district. Other than Wednesday, there's other options for Test Nebraska throughout our health district too. I believe those are on Wednesday and Friday, Laura, is that right? At Butler County and Seward, I think is adding another day as well.
Yes, and yes, so Butler County is Mondays.
Okay.
You guys, York is Wednesday,
yeah.
And Seward's Friday, but Seward's adding, I think it's Tuesday.
Yeah, I think they might be adding Tuesday as well, and that's something that we could analyze as well.
Seward.
In in the days ahead, we will take a look at that as well. But at this time, we're on the Wednesdays, and our Wednesdays are very heavily utilized. And yesterday, the week before, we had about 121 that were done through Test Nebraska, and yesterday we had 97 that went through Test Nebraska's, the latest count that I received. In addition to that, we continue to do testing at Willowbrook of staff and residents, and the Hearthstone as well on a twice a week basis. And we're even testing our residents in the dialysis center. So there isn't a day that we haven't done some testing, but we need to have a little fun too in the Christmas season. So if you've seen on Facebook, we actually tested Santa and I asked if it was a rapid test, and we got a rapid test done on Santa, and he's COVID free, and he's in our dietary, or he's in our cafeteria. So we need to celebrate the Christmas season as well, because it's been a stressful time, and we need to mix in a little bit of fun as we go too. So the vaccinations echo what Laura talks about. We talk about also that very next, if it'd be phase 1B, would be those elderly, the residents in our assisted living and nursing home that would also be vaccinated. So we're anxiously waiting, and we have not only through Four Corners on the allocations and getting those to our health district, but we also have community pharmacy that works with our long-term care, Willowbrook and assisted living, that have allocations that are coming as well. And we're hearing about the same time frame that we're looking on that end to get our allocations for the assisted living and nursing home. So a lot of irons in the fire, a lot of things happening, very anxiously awaiting the how this could change things with the vaccinations coming about too. So, let's see, if we skip down, we're keeping our restrictions the same level we have in our hospital and our other campuses. On elective surgeries, we're now trying to get, we're to the point of where we postpone some overnight stays on elective surgeries to the point that we really have to do some of them. And we have to factor those in as we can on some orthopedic cases. So we're trying to weave some of those in this week as we can, and watching our census as we go, because otherwise they turn into some bad conditions for our patients if we can't do that after a while. So we're not alone in doing that. I'm sure that's being felt all throughout Nebraska that way. And so still have the suspension of our inside visits for Willowbrook. And the Hearthstone, though, on some good news fronts is, knock on wood, some of the testing we've done earlier this week and we'll do later this week on our staff for the Hearthstone, if they continue to come back negative on that end, then you're going to see most of those neighborhoods in the Hearthstone go back to green level restrictions. So knock on wood, and that'll be the case, and we won't have any new, positives of staff, because more of the staff are coming back after their times off at the Hearthstone, which is very good to see. So we can continue to more easily staff our shifts, which can be very tough to do at times during this pandemic. So a couple other highlights really is that as of this morning, we do have 17 staff members that are off work. And this is, of course, out of our 485 or so staff members. 17 are off for some COVID-related reason. They either were tested positive, or maybe they're exposed to a member of their family, or were exposed to somebody else in quarantining, or they're awaiting test results. The good news is that a few weeks after Halloween, that peaked at 32. And so we're down to 17. Again, that's a good news in a scenario that's still too high as we go. So over the period of the 1st of December to the 7th of December, we saw in our ER 7 COVID positive patients that were sent home, 7 COVID positive patients that were admitted, and 1 COVID positive patient that was transferred to Bryan East at the time. And on the floor over that same period of time, we've seen 8 COVID positive patients admitted, and 4 discharged to home, 1 transferred to Bryan East, and 1 that was deceased. And at the time on Tuesday when I reported, we had 4 current COVID positive patients remaining on the floor. I can tell you that went up to 5 at one point, and now it's back to 4. And so we've got 4 that are in-house. Again, that peaked at one time a month or so ago, I think around that time at 8. And so being at 4 is good, but we still have to close down our hallway, the one hallway for our east hallway for the COVID-19 positive patients. Today, we only have 2 available beds on the other hallway, our west hallway. So we're fighting that challenge that is becoming more the normal for us of watching our census every day. And we'll be fine through it. We have been all throughout. We've got plans if things get tighter, and but that just tells you how the quicker we can get COVID-19 out of our health district, the better. And that frees up our capacity for when our census typically goes up in the winter as well, for injuries and things like that. So over that course of time too, we've continued to treat with remdesivir, convalescent plasma, dexamethasone. I think we're actually doing more of the dexamethasone as a method compared to the remdesivir nowadays too. Also have given 17 infusions of that bamlanivimab, and which is a monoclonal antibody treatment, and that would actually be through the 9th, through the first 9 days we've given that many, and 18 Regeneron infusions. 8 Regeneron infusions to outpatients, COVID outpatients, and the BAM drug, as I'll refer to it, it's easier to say that way, that has really prevented a lot of, we feel, some hospitalizations, and that's a very good thing, and a good increase of our ability to treat COVID-19 patients and keep our hospital beds open. So I think I touched on about everything, but I as well would entertain any questions anybody has at this time. Thanks.
Thank you very much, Jim. Henderson Healthcare does not have any updates to provide at this time. If we have anyone else from the healthcare sector, please feel free to speak up now. Otherwise, we will move on to the education sector, and I saw Mitch was on, so Mitch, you can kick that section off.
Thanks, Lisa. Good morning, everybody. I too will share some good news along with Laura and Jim from the YPS area. Fingers crossed, we're going to make it to Christmas. I still shake my head at that a little bit because I think I've said on this one early on during this whole situation, if we made it to October 1st and it's still in session, I thought that was going to be lucky. So I'm very grateful that we're a week away or so. So our numbers, like Laura and Jim were just talking about, are nearly as low as they have been in multiple weeks here. And so just some round numbers. We've been hit by the quarantine issue, like many schools and many organizations. We were up around anywhere, 100, 120 to 150 students at one point in time in 3 buildings. And so now, as I checked here, as this was going on, we're about 50-ish. And so that's a good thing. We do have 5 positive cases as we speak amongst students and staff, and they're isolated at this point in time, and so on. So like Jim said, 1 is too many, but yet we're hopeful that this trend of our numbers going down continues. So again, we're grateful for that. A calendar reminder for those parents that are on the Zoom and community members is we did make a calendar change, and we were scheduled to get out of school on the 22nd of December. And had a great conversation with our admin team and Board of Education, and we decided to have our last student day on December 18th. And the primary purpose behind that is on the 21st and 22nd, that will be designated days for our teachers and for students that are still behind at that point in time. And so really, we want those kids, first of all, to get finished up before Christmas, and that way they can go home and honestly not have to worry about school for a couple of weeks. Same thing for the adults. We really want our teachers to complete everything they need to during those 2 days and go home and not worry about school for a couple of weeks. Both groups of people deserve it. We're really proud of our teaching staff. They're doing a lot of things that you'll never see, to make sure that kids are getting caught up and so on and so forth. And so we're really proud of that group. Let's see here, activities wise, we've received some feedback on not allowing community members in to basketball games and wrestling and so on. And trust me, I wish we could. But just a reminder to everybody is that that is part of the DHM at this point in time, that it is household only. We are limiting the number of people that do come in to any activity. So whether it's a band concert, choir concert, basketball game, whatever it is, it's household only at this point in time. And that's just the way it is. And I don't want to be Debbie Downer here a little bit, but I don't anticipate this winter season changing too much. Our hope, my hope, I'll say, is that maybe we can move, if the numbers continue to go down, we'll be able to move to maybe 50% capacity and take the household category off and at least up our numbers a little bit. That way grandpas and grandmas can come in. But my opinion is I'm just not sure it's going to move beyond that, but we'll see. So again, just to finish up here, we're happy with our numbers at this point in time. We're happy that we're here to Christmas, because there were a lot of people that just didn't think that we'd make it there. And so shout out to our entire staff. They've been doing a phenomenal job. So as always, if you have questions, please let me know.
Thank you, Mitch. I do not see any of the other superintendents on at this point, and I don't see Heather from SCC on. And York College does not have a report today. They are on if you have questions. So I think, Mitch, you're it for the education sector. Thank you for that nice update. We'll move on to local government sector, and I believe Barry is on.
I am. Yes, good morning.
Good morning.
Nice to hear good news. Gosh, it seems like it's been a long time since one of these has been so optimistic, and so I'm really that's just fantastic. And so not a lot changing, I guess, on the city side right now. We'll just hope that everything that everybody's doing continues to help us go the direction that things are going, and that we can get through this holiday season without seeing anything go the other direction. And we all hear plenty of news about all the things that are happening. So let's hope that vaccines happen and all of those things. So just nice to hear positive news. On a city standpoint, not a lot right this moment. We've enjoyed the nice weather. They've continued to do some concrete and some sidewalk projects around, and so that's given us some extra time. And I know starting to deal with the mountain of trees, they've been starting to deal with that and trying to dispose of some of those from the ice storm. So appreciate all the city staff and all their efforts that have helped out on that project. But the council meeting will be next week. We just have a lot of reappointments and appointments and things to get done. So that'll pretty much conclude our business for the year. So I would say now I'm going to leave this meeting in a good mood, and let's keep it that way. So have a good day.
Thank you, Barry. And I do have a couple messages from other communities. There is no update. I spoke with Randy last night. He doesn't have an update from the county. So we will move on to faith, community, and nonprofit sector. Is there anyone on in that sector that would like to do an update? I'm not seeing anyone, so we'll just go on to the business sector. I only have a couple of things. Um, First, it looks hopeful that we may have a compromise on a federal stimulus bill. Both proposals right now do have additional PPP funding in it, as well as some education and some healthcare dollars. So keeping my fingers crossed, I'm following the legislation closely. So if something is coming down the road, I can get it out to the business community. And I know the schools and the hospitals are watching it from their end as well. In addition, the Nebraska legislative session is about ready to start. It will kick off in January. Our Nebraska Economic Developers Association Legislative Committee has already started to meet weekly. We're watching some potential bills. We'll be watching additional. And the governor has talked a little bit about if the federal government does not do any more stimulus, we may do some at the Nebraska level. So I will be sharing information out as appropriate. The other thing is just a reminder, we have a lot of retail businesses that sell in the store. We have a lot online. We have a lot of makers in their homes that are making product as well, from tables to signs to t-shirts. So if you're still looking for Christmas shopping, you can find them. I know both York Public Schools and Henderson Public Schools have a manufacturing academy where they share stuff. Might be a little late in the season. You'd have to call the schools to find out, but they customize product as well. So let's help our businesses here, whether they're in home or a retail or larger. Let's help them finish the year strong. We will have one more of these right before Christmas, and but reach out if you need me. You guys, most of you have my cell. It's on our website. You can reach me via email or on my cell number right now, and I can meet you anywhere you want. Madonna, I'm going to hand it over to you.
Thank you, Lisa. Good morning, everyone. I just want to highlight a few things during this holiday season. You will notice that many of our retailers are doing a great job making sure that our shoppers have a safe, enjoyable shopping experience. Several have expanded their open hours to be on Sunday. And there's a full list of those retailers on our website at yorkchamber.org/Sunday hours. In addition, the online shopping is something that you could do. York News Times wants to remind everyone about the Buy Local gift card page that is available. You can access that through our website, also through YCDC's website. So they really want you to encourage utilizing that. Also, because it is the holiday season, we want to make sure that children have good memories throughout the season. They don't need to be effective in their memories about what's going on throughout the COVID season. So our team has worked really hard to try to have that safe season for children to visit Santa. We did a practice run on Small Business Saturday, took a lot of that, transferred it over to the Santa Hut, implemented safe practices in the Santa Hut where children are able to visit with Santa on their own stool. Santa will even step out onto the porch to visit children. Currently, Santa's had some good traffic, and the remarks from the families are that they really appreciated this safe, comfortable environment where children just felt that it was very normal. So hats off to our Santa, who's done a great job fulfilling that role. We also have some different campaigns going on through our website and through our office to appreciate and thank our longtime Santa, who's kind of struggling a little bit. So outside our office is a lantern. If you have letters for Santa Dan, we encourage you to drop them off. The Barretts have been a blessing to our community at this time for years, so we appreciate being a blessing back to them. And then also just maybe keep connecting with our chamber chat for several different holiday things and several businesses and organizations that are blessing our community throughout the season. I do appreciate all the hard work throughout all the organizations through the whole district for keeping our community connected, safe, and happy. Have a great Christmas.
Thank you, Madonna. I really appreciate that. I don't see any questions for anyone, either on our chat or on our Facebook Live. So now, if you guys have anything, would be the time to ask. Otherwise, I'll echo what Madonna said and have a happy holiday. I hope everyone really enjoys Christmas.